Welcome to Dow Chiropractic and Acupuncture. I'm Dr. David Dow. Today we're in our exam room and we're going to talk to you about neck pain. So neck pain is something that you may not realize how much of a problem it can be. Neck pain ends up usually affecting more parts of the body than we realize. We may just have a little bit of neck pain and it may come and go. Maybe it's not bothering us too much, but it can actually be more of a serious issue. So first off, everybody usually starts off with a nice, perfect, healthy neck. And then what can happen over time is the neck can start to deteriorate over time. So that neck pain may be from a car accident, a fall, a sports injury, work injuries, poor posture. Maybe you're sitting at a desk, you're working at the computer, and that's making it worse and worse over time. But what happens is we all start off with a healthy spine, and we can get what's called a subluxation. And with a subluxation, the bones in your neck can shift out of alignment, start putting pressure on the nerves, and that can start to lead to the symptoms that you're having. And people may start taking medications for some of those symptoms that sometimes work so well that you're not addressing the cause of the problem. And because you're not fixing the cause of the problem, over time, it's just getting worse and worse. So here is a nice, healthy, normal neck. And we've got a disc bone, and that disc acts like a spacer, so there's plenty of room in there for the nerve. And we got a nerve in there that's nice and healthy and fat. We want that disc to be nice and thick to absorb impact. When we turn our neck, we want to make sure that these edges that come up against the nerve are nice and smooth, and this should be able to move around nice and easily. But what can happen in our neck over time is those vertebrae can start to deteriorate, maybe over 20 or 30 years. We lose that thickness of the disc, and there's not as much room in there for the nerve. We can have a herniated disc, a bulging disc pressing up against the nerve, causing pain and other symptoms. And this is almost bone on bone, and these pointy, rough edges can start to push against the nerve, and we lose that range of motion that we once had. And you can feel that, and maybe you'll hear some crunching or cracking in your neck, and that's not good. Now, we're going to look a little deeper here. When the neck gets injured, those nerves are going to be mostly eyes, ears, nose, and throat that get affected. And what we'll see a lot of times is some neck pain that can progress into maybe headaches, which can progress into migraines as it gets worse over time. It's always easier to fix a problem early on rather than waiting for things to get much worse. But the nose and throat issues can be allergies and sinus problems. Fatigue is one of the most common problems that can come from the neck. But sometimes as it gets worse, you might get hand and finger numbness. But those nerves can actually affect what are called our parasympathetic nervous system, which can lead to issues of anxiety and depression that can come from a neck injury. Also, a neck injury can affect your balance and coordination, and that's easy for us to test for. But if that actually happens, you may start developing posture problems or joint issues in other areas of your body. So stay tuned. We're going to do more videos. We're going to give you more information about this. Our next video, we're going to give you some tips and tricks of what you can do today, right away, to get some relief for your neck. All right, stay tuned.